Thank you, Chair, and thank you, ministers and your colleagues, for being with us in these difficult circumstances. Minister, you and your colleagues stated in your presentation and in other remarks that data and tracking are going to be central to fulfilling the promise of the framework. And you provided us with some baseline data based on age and gender. Can I assume or that the data that you collect and will continue to use and analyze to provide appropriate services will also look at PTSD through the lens of race and intersectionality?
Thank you very much, Senator. And yes, the intention is to have as granular data as possible, because of course we know that different groups of people experience trauma differently, and there are different outcomes as well. And so I'll turn to my officials to speak a little bit about how that's being designed. But the great news is when we collect data ourselves, we can design how that data is collected. The bigger challenge, as we've learned through the pandemic, is when we are relying on provincial territorial partners, and data is very hard to coordinate across levels at the granular level that you're suggesting. But I will turn to my officials.
Thank you, Minister. So first and foremost, we do have a range of data gaps, as you can imagine. We starting with which traumatic events are most associated with PTSD, just very basic kind of gaps. How a diagnosis of PTSD is related to screening positive on symptoms, just understanding the mechanisms. There are data gaps. And the surveys that Minister Hajdu mentioned in her opening remarks are a way in which we hope to be able to try and shine some light on these topics, the survey of stressful events in mental health, for instance. And in those surveys, we're trying to get content that gets, of course, into some of the issues I said that we're missing data on just the basic diagnostics and the details of the events associated with PTSD symptoms. And that is drilling down, Senator, to your question, into occupational groups, but also into populations and social impacts of PTSD and social supports. So I think maybe we could look at the questions and make sure, as we're going through this work, that we're going to be shining light in the areas that you're speaking to. In general, we just have a lot of data that we need to be gathering and focusing on these topics. It's an area where things have been incomplete, and these new surveys are really going to help us. Now, I don't know. I don't want to talk over Candice. You might want to jump in on this aspect.
Yeah, thank you for that. And you're correct. It is something that we always put on a broad lens because we do focus on those most vulnerable, regardless, again, if they're frontline workers or not. The initial data pool that we did have from the survey did show 62% of Canadians are experiencing some sort of impact with regards to PTSD in light of COVID. That ergo just demonstrates the need to unpack and pull those layers back. With the second round that'll be coming out this fall, we are again digging down to ensure that we cover the race, place, all ethnicities, geography as well, because we also know that there's going to be social and economic impacts. So it's going to be a broad set of criteria, working again with provinces and territories to ensure that we can get access to the data.
Thank you. I certainly look forward to seeing this data.